Today we will be discussing a clinical case study of Dr. John Nash and a Beautiful Mind. John Forbes Nash Jr. was born June 13, 1928 in Bluefield, West Virginia. He is depicted as an incredibly gifted student and mathematician, earning his doctorate from Princeton University at just 22 years old, and eventually the Nobel Prize in Economics later on in his life. Beautiful Mind essentially chronicles his life as a graduate student and professor and illustrates his eventual descent into madness in the form of schizophrenia. Throughout the entirety of the movie, you see the various incredibly vivid hallucinations he experienced during the majority of his life, and how it took a serious toll on his work as a professor and life as a normal human being, husband, and father. Throughout the movie, John Nash displays many of the symptoms of schizophrenia, which is an illness characterized by the DSM-5 as a psychotic disorder. In order to be fully diagnosed with schizophrenia, a patient must display two or more of the following symptoms: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, or negative symptoms, which include diminished emotional behavior or avolition. One of the more obvious symptoms that John Nash displays throughout the movie of schizophrenia is his incredibly vivid auditory and visual hallucinations. They begin upon his arrival at Princeton University as he experiences seemingly real visions of his supposed roommate Charles and Charles's niece, Marcy. He converses with Charles and Marcy and treats them as if they were real people for pretty much the whole movie. He isn't able to escape these hallucinations, however, until he realizes the fact that Marcy never aged during the entirety of the movie and thus wasn't a real person. A second symptom that Nash displays throughout the movie of schizophrenia was the multitude of delusions he experienced. His status as a nationally renowned mathematician and professor may have fed his delusions of grandiosity and nihilism, in which he believed he was recruited by the DoD to decipher a secret Russian code and prevent a nuclear strike on the U.S. In addition to the nihilistic and grandiose delusions were his referential delusions, in which he believed he was being relayed secret messages through television shows, newspapers, magazines, and other aspects of daily life. During the time he believed he was working for the government, he would occasionally drop envelopes which detailed his supposed progress in cracking these codes at what he believed to be a secret government facility, only to later realize it was nothing but an old condemned mansion and that his letters were sprawled out across the front lawn. His imaginary work and newfound sense of importance to the nation likely facilitated the development of his persecutory delusions, in which he believed the Soviet agents were trying to kill him and keep him from cracking their fictitious code. Some of the less obvious symptoms of schizophrenia in the film were negative symptoms. In some cases of schizophrenia, a patient will display negative symptoms such as diminished emotional behavior or avolition that the patient previously didn't have. In Dr. Nash's case, however, his emotional behavior showed a spike in prevalence after the onset of schizophrenia occurred. He seemed to show increased paranoia, mania, and even agitation towards others. The only time in which he showed negative symptoms were a result of his consumption of medication, which put him into a almost vegetative and catatonic state. Unfortunately, there's no current cure for schizophrenia that exists. However, medication treatments known as antipsychotics exist to help bring down or reduce symptoms. The goal of this treatment is to effectively manage signs and symptoms of the lowest possible dose. Other medications, such as antidepressants or anti-anxiety drugs, may also help. However, it can take several weeks to notice an improvement in the symptoms. Because these medications can cause serious side effects such as the aforementioned avolition or diminished emotional behavior, some of the patients may be reluctant to take them. In the movie, John Nash is seen to show decreased responses to stimuli and is seemingly in a vegetative state. And Dr. Nash realizes these side effects and as a result is seen hiding the medication in a drawer so that he doesn't have to take them. Reluctance to cooperate with treatment may affect drug choice, meaning a patient who is resistant to taking medication consistently may need to be given injections under the supervision of a doctor instead of taking these pills. To sum up, we believe that A Beautiful Mind very accurately illustrated the physical and mental tolls of schizophrenia on not only the patient, but on the friends and family members of the patient as well. In the film, we see a multitude of symptoms indicative of schizophrenia in the form of Nash's delusions, hallucinations, mania, and paranoia. The film makes him more than just a statistic and gives the viewer an insight on how this disorder strips a person of everything that makes him a normal human being and takes a toll on those in their lives as well. Film can bring awareness to psychological disorders and shine a light on the impacts they have on people and their families, giving them the potential to be incredibly useful tools. When done incorrectly, however, movies can reinforce stereotypes and do enormous damage. Movies can make characters afflicted with these illnesses, such as war veterans with PTSD, seem like violent individuals unfit for society and thus cast a negative light on them for all the viewers to see. Ultimately, it falls on filmmakers to really do their research and work hard to accurately portray the amount of difficulty these people experience in their daily lives.